Hi, everyone. Welcome back to PINK365. For our YouTube viewers, you may know we are back in our regular setting. These studios, there's just everyone and their mother apparently has a podcast in New York. So they're kind of booked and busy all the time. But I'm especially glad that we have a podcast today because this is for people who have been affected by cancer, but also people who have not been affected by cancer, who are wanting to learn something new. And there's so much that we're going to talk about that will just improve anyone's life and lead to a better, more well-rounded and well lifestyle. Today's episode is supported by MBC Cure, a nonprofit dedicated to funding research and advancing treatment options for metastatic breast cancer so that people living with metastatic disease have better outcomes and more time. This episode is also supported by Cancer Culture, a platform creating space for honest conversations about the cancer experience and the life that continues beyond diagnosis. Thank you so much. Today's episode is super, super special to me because I'm sitting down with someone who is an expert in this space, but she is also my personal oncologist. Dr. Eleonora Teplinsky is the head of breast and gynecological medical oncology at the Valley Health System, and she's been my oncologist for actually the past 3 years. She's also a clinical assistant professor of medicine at the Icahn School of Medicine at Mount Sinai and has been practicing oncology for over a decade. She is legit. Beyond the clinic, she's built an incredible platform educating women everywhere, whether that's through her Instagram, where she shares evidence-based information with over 40,000 followers, or as the host of the Interlude podcast, where she breaks it down and what it actually means to live with and beyond breast cancer. She's been nationally recognized for her work in advocacy and education, especially in the survivorship space, which is so important. And she's spoken at major conferences like the American Society of Clinical Oncology, Living Beyond Breast Cancer, the Breasties, and For the Breast of Us, really focusing on improving quality of life for people navigating breast cancer at every stage. What I've experienced firsthand is that she doesn't just care about treating cancer, she cares about how you live through it and beyond it. She's deeply committed to advancing research, addressing disparities, and making sure patients feel informed, supported, and seen. And she's taking all of that knowledge even further with her upcoming book, Beyond the Pink, Navigating Life, Health, and Breast Cancer, which is available for pre-order now. So important to pre-order books, and will be released in September 2026. It's a patient-centered guide to the mental and physical challenges experienced by previvors, survivors, and thrivers. This conversation is everything I wish more women had access to. Clear, honest, and actually empowering. Dr. Teplinsky, welcome on PINK365. I am so excited to have you here.
I'm thrilled to be here.
We've been in so many different settings at this point, from your office where I am in the nude to galas where I got to present you the Icon Award at the Pink Agenda Gala, now in a podcast studio. I'm like, wow, we're really great friends at this point.
We are.
My mom is definitely so jealous too.
So I said to my family, I'm doing a podcast with Miranda, and they all know who you are.
Oh,
like, great.
Well, I got to meet Dr. Teplinsky's whole family at the Pink Agenda Gala, and it was so special to see all of them being there while you were being honored.
Yeah, it was really nice.
It was so nice. And you just ran the LA Marathon. We haven't even caught up about that.
Oh yeah, it was wonderful, but hot. How'd your boyfriend do?
He finished. Probably didn't get the time he would have loved to get because I heard 5,000 people didn't finish.
Yeah, I mean, it was 90 degrees at the finish line. It was crazy. But I will say LA showed up. I mean, the support, I've never done LA before. New York has amazing support, but people were like lined up, handing out every possible support thing you could do. It was great.
I'm obsessed. Also, can we just take a moment for the fact that you are a full-time oncologist and you're running marathons?
It's my thing.
Like, how did...
It's my thing.
Oh, it's my thing.
It's my thing. I've been running. I mean, I ran in high school. I joke that if you can run a 5K, you can run a marathon. That's how I've gotten many people to run marathons.
Yeah, wow.
But you can.
Okay.
And it's the one thing that I do really only for me.
Yeah, I love that. And that's so important because you have kids, you have family, you have very serious work you're doing every day, research.
So it's the one time I can disconnect and just focus. And people always say, like, oh, what do you think about on the run? Nothing. Literally, my mind is blank. Like, I can run for 3 hours and people are like, what do you think about? No idea. Nothing. It is my, exercise is not therapy, but it it really does help me like just kind of disconnect from the world.
I think that's how I think that I should be when I exercise. But like my inner monologue is like, oh, this is so hard. Am I dying? Are my lungs collapsing?
Yeah, that's happening. That's
it
happening
is
too. Yeah.
Okay. I just want to like, yeah.
And most of it, I'm like, when is this gonna be over? Why is this fun?
Okay.
It's not fun. And then you finish and you're like, oh, they're endorphins.
There are beautiful moments during running.
Yeah. Most of them are painful and sucky at times.
Okay. Yeah, I just wanted to like make sure like you weren't like fully meditating.
Oh, no, I'm not like Zen. I'm like, this is hard, but I'm not like processing the world as I run. You know, I'm not like in the shower. When I shower, I'm always thinking 5,000 things. When I run, I don't think of things.
Yeah. Okay.
Mm-hmm.
I feel good about that.
Yeah.
Let's just jump right into it.
Let's do it.
So for those listening, this is going to be primarily about cancer, but you do not have to have had cancer. You don't have to have had a family member be affected by cancer to get something from this episode. Well, one, we love being curious people and learning about all different kinds of things. But there's also going to be a lot of tidbits in here where you get to just learn things that are going to benefit your overall health so much in regards to preventing cancer and just living an overall healthier lifestyle. So I commend you for showing up today. Thank you for being with us. And let's hop right into it.
Let's do it.
So for context, if you follow either of us on social media, well, yes, we're talking about cancer a lot of the time. Dr. Teplinsky is my oncologist. And I actually got a question in here that said, how... It made me giggle a little bit. It said, how early do I need to start seeing my oncologist? Like, what age should I start seeing them?
So you hopefully don't need an oncologist unless you've been diagnosed with cancer or very high risk and things like that. But I think the key is to be aware of cancer risk.
Right.
That's not, and it shouldn't be scary. It should be proactive, just like you're thinking about when do I need to get a pap smear and when should I be getting a colonoscopy, right? Thinking about when should I be getting a mammogram and what's my breast cancer family? What's my family history of cancer? So really being proactive, not scary, but thinking about, let me go and talk to my doctor about what my risk is.
Yeah. So when structuring this episode, I had asked a question box on Instagram. I did not expect we got so many questions from people online, which is so flattering. Like, and also an indicator that people need this information and really use you as a resource. So when I was going to format this episode, it's basically Q&A format from my question box on Instagram. So let's just give the people what they want. Starting off, I'm obviously a weird case, I guess, but we are seeing cancer risks go up as time has gone on, and average cancer age maybe is going younger.
So we are seeing younger and younger people get diagnosed. So when you look at every year, they put out new statistics and new numbers, and every year it's rising in women younger than 50. And
is this for breast cancer?
For breast cancer.
Okay.
But other cancers are on the rise too. Colorectal cancer is rising in younger adults. So although we're talking primarily about breast cancer, we should be thinking about cancer risk kind of altogether for everything. But in breast cancer specifically, the rates are rising in women younger than 50. And why is that happening? And that is the question that we get asked all the time. And honestly, we don't really know. Is it environmental? Are there things that we're exposed to? Maybe. It becomes really hard to study that. How do you measure what people are getting exposed to in their environment? Things we do know that some things are related to increased risk. We know that girls are getting their period younger in life, and that may be a contributor, but it's not the only contributor. People are having children later in life or not having children at all, which again may increase risk. But the thing when we think about risk that's really important is that risk is not causal. So just because you have this one factor does not mean you will get diagnosed with cancer. Or if you don't have that factor, it doesn't mean you won't be diagnosed. So
that's so important.
It is, because I think we hyper fixate. Like, for example, we know breastfeeding reduces cancer risk.
What?
But I see so many women who go, but I did all the right things. I had multiple children, younger in life, and I breastfed all of them. And here I am, right, still sitting here with a breast cancer diagnosis. So risk factors don't necessarily, it's not a direct link.
Yeah. I mean, that was something, obviously, I was like, for a hot second trying to figure out, like, why did I get breast cancer at 19. Why was it growing so fast?
And I think it's really important because people then say, if I know what I did, then I cannot do it again. That's what's going through people's minds. But here's the thing. You didn't cause your cancer. There's nothing that anyone did that caused it. I want to make that really clear because and people hear, I hear this all the time. People will tell me, oh, so-and-so told me, it's because I ate too much sugar or I wore an underwire bra and any of the other number of ridiculous myths that are out there. And so there is nothing that anyone did to cause their cancer. I think it's really important that we get out of that shame and that blame and move forward.
Yeah, it's hard to do. I still think I used to have a peanut butter Nutella sandwich every single day for lunch, and then I would come home and eat spoonfuls of Nutella.
Mm-hmm. I grew up in the Pop-Tart era.
Yes,
Pop-Tart
my mom says this all the time.
Day for
devil
breakfast.
Dogs, whoopie
pies, the little, the cakes.
Yeah.
I mean, those were like a staple in my house, right? You talk about processed stuff. And so, no, I think that everything comes together in somebody and you just can't, unless there's a genetic mutation where you can really identify the risk. Otherwise, we can't. And I don't think it's helpful to say, what did I do? Because you didn't do anything.
Yeah.
But I think it's helpful to say, all right, how am I going to optimize my lifestyle going forward? And that's something that all of us can do.
Okay, so talking about genetic mutations or genetic risks, if someone's in their 20s and 30s, this is a question, and have family history, what should they be doing?
Great question. So I think starting with knowing your family history is number one. And when we think about family history, it's not just mom and dad. We want to go out grandparents, great-grandparents, uncles, aunts, cousins. We want to do a really broad look. And if there is a signal, of cancer in the family, really talking to your doctors and saying, should I be getting genetic testing? Sometimes families are really small, and so there isn't a history of cancer, or sometimes they're really big and there isn't a history of cancer. But that's a good place to start. And then also thinking about other cancer risk factors that may warrant earlier screening or genetic testing.
Okay, awesome. Signs and symptoms of breast cancer that people overlook, maybe.
So most breast cancer does not have symptoms, and that's why we do recommend getting a mammogram.
Wow.
Because that's going to pick up something before we can feel it. That's the goal, right? We want to pick up something when it's really small, when we can't feel it. But let's say a lot of younger women are below the age where they would be getting a mammogram. And so then they're going to, often they feel it, hypothetically. But then you can feel a lump. You can feel something. Sometimes people say, I don't feel a lump, but I just feel something doesn't feel right. They rub their hands over and they're like, this feels firm or this feels vague, something abnormal there. Any discharge of the nipple, especially bloody discharge, any change in the skin texture, any thickening of the skin. But bottom line is anything that feels different. If all of a sudden you're like, this doesn't feel right to me, something feels off, get it checked out and make sure, don't take no for an answer.
Yeah. So I don't harp on this, but I think about it semi-often. I totally noticed a dimpling in my breast before I felt my lump. And I remember standing naked in front of the mirror and there was a little just indentation or a little ripple exactly where my lump then was. And I was looking at it and I was like, that's weird. Passing thought. Yeah. And I think I kind of kept staring at it, but I had no idea that was a sign of, I didn't even know, of course it was abnormal, but I didn't know it was abnormal. Mm-hmm. So I didn't do anything about it. And then I felt a palpable lump. And
yeah, so that lump may have been pulling the skin inwards a little bit,
right,
which is why you can get that indentation or that dimpling. But you're right. I mean, you were so young. And that isn't what's going through everyone's mind at the first thought.
Right.
And I think this conversation is not meant to cause fear, but really to empower people to say, look, something is off. Most likely maybe nothing, but I don't know, and I'm going to get it checked out. And so not to necessarily, and I think too, if you feel something, give it a week. If it's kind of vague and you're not
That was
sure.
Our next question, how to tell the difference between something that actually needs to be checked out versus anxiety-driven spiral.
And I think there's not always a way. And that's okay. Generally, we say, look, if it's been a week and it's not going away, but if you feel something and they're like, this doesn't feel right, don't wait.
Okay.
I would rather people call me and have them come in and feel it and then say, I'm not as worried about this. Let's wait in a week versus, you know what, let's just get an ultrasound or, or a mammogram depending and get it checked out. So I think use your medical team to guide you a little bit on that.
Okay. I want to get into a section that I'm so fascinated by that I don't see like a ton of people talking about, but you really focus on, which is why I just love being a patient of yours. And that is having a preventative lifestyle, all the things between diet, exercise, alcohol, weight, metabolic health. I want to talk about alcohol first.
Yes.
Because we talk a lot about this and it's so funny. Like, yes, I think we will do a video together and like people see us in a professional setting, but we have had conversations in our appointments where I'll come into you and tell you, like, I know that I'm drinking too much. I'm partying all the time on the weekends. Like, I love going out. It's such a staple in my lifestyle right now. And like, I'm definitely having way more than the recommended alcohol.
I think this is hard. I mean, this is the time of your life where you shouldn't even have had to worry about this, right? And I think that's the hard part. I think this diagnosis, I don't know if you feel this way, but did it force you to grow up faster in a way?
Oh my gosh.
Right? Like,
yes. I think about things that like 50, that my mom's like barely, she just got screened for her bone health.
Yeah. I mean,
I'm
yeah. Double date to the bone density.
Oh gosh.
But I mean, these are things that you shouldn't have had to worry about, right? And so I do think it's a very difficult, challenging conversation. I will say we know that alcohol is a cancer risk factor. It is, again, same thing. Just because you drink does not mean you will get cancer. And if you don't drink, does not mean you won't get cancer. Whenever I talk about this, that people will say, but everyone in my family didn't drink and was diagnosed with cancer. It's not the only thing, so I think just really important to make that distinction. Alcohol can increase cancer risk in many different ways that we're still trying to figure out, but it includes things like DNA damage, and some of the metabolites of alcohol are directly toxic. It can increase exposure to other carcinogens. It can generate reactive oxygen species in all these different ways. It can impact your hormone levels. So many different ways that alcohol can cause cancer or can contribute to cancer risk. But it's a personal decision for everyone about what to do. We do say if you're the guidelines vary depending on what you look at. When you look at the numbers, it does look like cancer risk kind of goes up after you have about more than 3 drinks per week on average.
3 drinks per week.
Now, that is, if you're going out, right, that may not be a lot for some people and it may be a lot for other people. Everyone's different. Everyone has a different definition of what drinking is for them.
I think when you actually 3 drinks, you're like, oh, 3 drinks. But then when you actually sit down and you go through your week, I think for a lot of people, it looks different than what they would imagine when you count and tally.
Exactly. And I think the other part that we don't think about necessarily is when you think about you're going out for a glass of wine. Well, they're probably pouring you a glass and a half.
Oh, yeah.
Right? Or you have a beer that may be higher in alcohol content. Well, that's now maybe 1.5.
Yeah,
right?
it's like there's a lot of arbitrary.
Exactly.
If you're making your own cocktail at home, we're pouring doubles in my house. Like, what's going on?
I think that what I try to think about is really start thinking about your relationship to alcohol, right? For a lot of people, what I urge people to do is to get away from, I had a hard day at work, it's been a stressful day, I'm going to make dinner and have a glass of wine, right? Can you substitute that for maybe a mocktail?
Right.
There's a lot of great non-alcoholic products out there. And then start thinking about, when you are drinking, really being intentional about it. Are you enjoying it? Can you, when you're going out, alternate one drink and maybe a mocktail? So For a lot of people, it's that social environment
Yeah.
of I'm going to hold a drink and sip
Yeah.
and that kind of thing. So really thinking and being a little bit more intentional about it. What I hear a lot from my patients is they'll say, you know, I know you said 3 drinks a week, but I feel so guilty when I even have 1 drink. I'm not enjoying it because they're thinking about that risk.
Right.
And so then if you're not enjoying it,
Yeah.
don't do it.
Yeah.
You know, I think if you're enjoying it, so I think there's it's very complicated. And the alcohol conversation is
It's important.
It's important. It's a big one. But I think the key is the studies show that half of Americans, or nearly half, are not either aware of the link between alcohol and cancer or are unsure about the link between alcohol and cancer. Half. So what I think is important is at least to have the conversation.
Yeah.
Right. And at least have the conversation so that everyone's aware of, okay, maybe there's a risk. And then thinking about what are the other things that I could be doing? So if I am going to choose to have a few drinks, where else can I be mitigating my risk?
Yeah.
Right. So what are we doing with exercise? What are we doing with diet? Right. It's not just one piece of it. It's how are we sleeping? How are we managing our stress? Right. All of these things about how to live a healthy lifestyle. And I think that at the end of the day, it's a decision that everyone has to make for themselves.
Yeah. Talking about exercise, so exercise you're saying could actually decrease your risk of getting cancer?
Exercise reduces not only your risk of being diagnosed with cancer, but also reduces your risk of cancer recurrence.
Wow.
Which is huge.
Yeah.
Right? These are things that we can actionably do. And I think where a lot of people get stuck, especially if you don't exercise now, you're like, how do I go to the gym? What do I do there? And
It's a big jump to make.
It's a big jump to make, and I don't have 45 minutes to do it a day. So you start slow. Maybe it's, you know what, instead of hopping in a cab, you're going to walk the 5 blocks. Maybe instead of, if you're watching a show that has a commercial that, you know, no one has commercials anymore, but, you know, maybe you're on Hulu. And
find a different analogy.
Yeah. You know, you're going to get up and, you know, maybe you're going to lift some weight, you know, do some bicep curls or something.
Jumping
jacks in between. I have weights in my office that if I have 5 minutes, I'll just like, you know,
throw them around.
Do some things. But figuring out what are the little pieces that I can do, and then you walk your way into, all right, you know what, maybe I can go to the gym and walk on a treadmill for 10 minutes, right? And you build up to it. But you have to figure out that plan, and it can't go from 0 to 180.
Yeah. It's like, you know, when you have those like moments of like a New Year's resolution and you're like, I'm going to go to the gym 6 times a week. I'll give myself 1 rest day.
Yeah.
I'm not eating out anymore. So I'm only going to eat colors of the rainbow, all organic food. And I'm going to say mantras and affirmations to myself 3 times a day.
Like, you failed before you started. I mean, and maybe that works for some people, but realistically, what are SMART goals, right? No, it's not. I mean, not at all, right? So you think about where are the healthier choices that I can make along the way. So maybe I am going to go out to eat. I'm going to order a takeout, but I'm going to pick something that has, you know, some more vegetables or some whole foods in that.
What are the guidelines for exercise? Like, ideally, how much are we exercising to decrease risk?
So ideally, what the guidelines say is getting to 150 minutes per week. So that's about 30 minutes, 5 days a week, or even more, but starting slow. So if you're at zero, 150 minutes is hard, right? Yeah. So maybe you say, I'm going to aim for 20 minutes 2 times a week.
Love.
And make that your goal that you are happy with.
Yeah.
Because if you're like, all right, I set out to do 20 minutes twice a week, I've accomplished that goal. Go me, I did it. And then next week you can think, all right, what's going to be the next realistic goal for me? Rather than setting a goal that you're going to fail at from day one.
And then you're just like so annoyed with yourself. Yeah. You're annoyed with the goal.
You've beat yourself up and that's it. So really starting, and when we think about exercise, we're thinking a combination of cardio, of strength training, resistance training, and balance and flexibility. So sometimes people are pivoting too much in one direction.
Oh, who?
No one I know.
Last time I went in, I love to really get into things in different seasons of life. So when I was running, training for my half, I did not see a weight. Like, that was not part of the process. Then I started weightlifting, did not go on a run for months. And then like Pilates, then I'm not doing anything else. So I would not say that I have an addictive personality, but I just get in my routine. I get in my flow. And now I'm like really working on shaking things up. I did berries right before this.
Perfect. So combination of all the things.
A little bit of weightlifting, a little bit of running. It kicked my ass. Crazy. So that's like a big, but I've been working out for a while. So I'm like, okay, I've worked my way up. But yeah, finding that balance can be hard. And I think the best like approach you can do is running is free. Speed walking is free.
You need
going
a pair
for
of
a brisk walk.
You need a pair of
that's
sneakers.
super, super accessible. You do not need to go to a fancy gym for that. And then, but lifting weights, you kind of need weights, right?
You kind of need weights, but you can get, on Amazon, you can get something affordable. If you want to have something at home, there's 2 programs that I love. Living Beyond Breast Cancer has on their YouTube, it's free. It's called Be Active, and it's a great series of like 20-minute YouTube videos, a great place to start.
Love.
Live Strong also has a great Cancer Fit online program, which is like $5. So that's a great place. Sometimes people say to me, I don't know where to start. I want to lift weights, but I'm recovering maybe from mastectomy or I have lymphedema and I'm not sure what to do. That can be a great place to start, but start slow and also find a friend to do it with if you can. That accountability is huge.
Working out with friends is the best. I have all my online programs that I love, like Simi Clark from Form, Melissa Wood Health has an online platform, Sculpt Society has an online platform, and they all have a lot of like range between cardio, sculpt, lifting in the gym. They have a lot of like pre and postnatal stuff.
And you can
doesn't apply to me,
do body weight squats, body weight lunges. It's just start moving.
Diet, eating. What does that look like?
You want to try to move away from processed food, especially ultra processed food.
What is processed food?
So basically, the best way to think about it is it's food that's been modified and modified and modified. And I always, the easiest way to tell, look at the ingredients. Do you recognize them? If you don't recognize half the ingredients, that's maybe sometimes food. It's not going to be an always
food. Like, is a tortilla chip? Because
everything's processed to a degree because we're not on the farm picking, the food and eating it. So everything's processed to a degree. But things like chips are going to be kind of in that more heavily processed category rather than, maybe, again, like than fruits and vegetables that are very minimal processing.
What's like a 1 degree processed food? Like a salsa?
Maybe salsa or like hummus,
hummus.
Chickpeas, right?
But like churned. Exactly. But like there are some hummuses that have like just chickpeas.
Exactly.
And then some that are like chickpeas, glycethamine, blah, blah, blah.
Exactly. You got to look at the ingredients, right?
Yeah.
Look at the ingredients. I always give this analogy years ago. I was at the grocery store with my daughter, was very young at the time, and she liked beet chips. So we looked at the ingredients, and you had one that was just like...
She liked beet chips?
Beet chips,
okay, little diva. I love that.
Why? I don't know, but she wanted these beet chips. And so one bag just says beets and like a little bit of salt. Great. And then one had 20 ingredients. I was like, well, why? And double sugar, all the things.
Yeah.
So look at the ingredients.
Yeah.
The less, the better.
Okay.
That's the easiest way to think about it.
Yeah. And like an apple, it's like there's not even an ingredient list. It's just apple.
You eat your apple. Exactly. So, and then things that you can make if we make them at home, obviously there's always less processing to them.
Right. So what about like meat?
So this is controversial. Red meat, we do recommend limiting consumption of red meat because it is a carcinogen, especially more specifically even than red meat, processed meat. So things like deli meat, bacon, hot dogs, sausages, those are all really processed meats, and that is a class 1 carcinogen.
What about, did you say beef?
Beef. So red meat is going to fall into that class 2 carcinogens, which is kind of probably carcinogenic. It's processed meat that we really want to limit. So
like a breakfast sausage.
We try to stay away from those.
Yeah, we're not vibing. That's like I think people think that's really good for you.
Well, because we're also living in this world of protein, right? And the protein craze. And so it has a lot of protein. And so I'm not saying that you shouldn't eat any processed meat or red meat, but just think about your consumption and trying to limit that,
If you're eating a breakfast sausage every single day.
Exactly. If you're having one on the weekend, great.
Yeah.
But if you are having it every day, maybe we should step back. And the guidelines about how much processed and red meat to eat really vary. Some say higher amounts, some say less. So I think figuring out what's going to be right for you. But trying to limit that red meat and processed meat consumption if possible.
Okay, what about chicken and turkey and fish?
Those are fine. Those are great sources of protein. There's a lot of controversy again about, or people have different opinions about, should you go, you don't have to be only vegan. You don't have to be, a vegetarian. So it's a personal choice. But chicken and turkey and fish are great options, are good sources of protein. So I think that's fine. Again, thinking about how you're eating them, how are you cooking them, avoiding all that processed stuff.
Do you eat meat?
So I do eat chicken and turkey. I eat a lot of fish. I was plant-based for a while, like 5 years.
Wow.
My husband went fully vegan. And then it felt like I did want, you can get all your protein if you're vegan and plant-based. But for us, it was kind of a time to bring some more chicken and turkey back into our day-to-day. And our kids eat that. So it was hard to make multiple meals.
Yeah.
So I do eat it. I really don't eat red meat, maybe once a month or so, but I usually stay away from that.
Okay. Refined sugar.
Mm-hmm.
Is that feeding cancer?
So this is a myth. Sugar does not feed cancer. And where this myth originates from, or at least where I think it originates from, is when people get a PET scan. PET scan, they inject a sugar molecule that goes to areas that are very metabolically active or growing quickly. And so then that area looks bright on a PET scan. So if a cancer is growing quickly, it'll uptake that sugar molecule. That area will look very bright. So that kind of people are like, oh, well, here's your sugar molecule feeding the cancer. But if you are not eating sugar, your body will make glucose, which is sugar, to, for the cancer. So it's important to understand that sugar directly does not feed or cause your cancer to grow. With that said, we don't recommend, eating, the guidelines don't recommend consuming a ton of refined and processed sugars because that's not good for our metabolic health.
Okay.
And things like that increases risk for diabetes and, all of that.
Right. Okay. So is there a number?
There's no number. That would be too easy. No, there's no number. I think just, again, thinking about what am I eating? And I try to explain this. This is what I tell my kids. What are you eating some of the time? And what are you eating all of the time?
So someone who has a sweet treat every night.
I mean, again, what kind of sweet treat are we talking about? Are we talking about a little piece of dark chocolate? Or are we talking about a giant 500-calorie cupcake?
Okay, noted.
Yeah.
What about some frozen yogurt? I love.
I think I'm not here to be like, this is what you can have and can't have, right? I think you have to think about
answer.
Yeah. I think you have to think about, what am I eating every day? How does this fit into my overall, right? Am I getting enough protein? Am I getting enough healthy fats? Am I getting enough fiber? We don't talk about fiber enough. Fiber is huge.
What's the deal with fiber?
Fiber is amazing. It supports us in so many different ways. And here's where we have a clear recommendation, at least 25 to 30 grams of fiber per day. And more than half of Americans don't get the recommended amount of fiber.
How do I get fiber in my diet?
So lots of ways. Fruits and vegetables are a great source of fiber. Certain grains are a good source of fiber. And here's why, people say, how do I know how much fiber I'm eating? Or am I getting enough protein or calcium? And so everything has nutrition labels, have all the information there. Or, we're using a lot of ChatGPT these days. So ask ChatGPT, here's what I ate today. How much fiber was that? How much protein was that? That could be a way to...
And how much protein are we supposed to have every day?
This varies. There's some guidelines. What the U.S. recommended daily allowance has just changed. But on average...
To have more?
To have more.
Okay.
But what was there before was a little bit low. So we generally say somewhere... It's going to look different for each person, between 1 to 1.5 grams per kilogram a day of protein.
Put that in chat.
Put that in ChatGPT. But if you're, let's say, recovering from surgery or preparing for surgery, you might need higher protein
per
amounts.
Kilograms, as in per your weight?
Yeah. So if whatever your weight is in kilograms.
Okay.
And then you're
1.1.
It's anywhere from 1 to 1.5. Some people say a little bit
weight.
more. It varies.
Okay.
And I think it depends on what you're doing. Are you lifting weights?
Yeah.
Are you recovering from surgery? Do you need higher protein needs?
Okay.
So it varies.
Noted. Let's talk about GLP-1 medications. Cancer risk. A lot of people are going on GLP-1s. even my age.
Yeah.
And it's controversial. However, there are a lot of people going on it for great reasons.
So there's a lot of hype right now with GLP-1s.
Yeah.
And I am not an obesity medicine specialist, but their GLP-1s have really clear benefits for many people.
Wow.
And I think what we're starting to see in terms of a cancer signal, this is very early.
Okay.
But we do know that GLP-1s can likely reduce the risk of being diagnosed with cancer. And we don't know if that has to do because of the fact that they are causing people to lose weight, or if there is, more of a metabolic health, insulin resistance component. But there's a very early signal that they might also reduce the risk of cancer recurrence. Again, is it the weight loss? Is it some sort of direct benefit? Is it the metabolic changes? To be determined.
But I'm not going on a GLP-1. That would be crazy.
Yes. And so, but this conversation, these signals have led people to say, well, should I be going on a GLP-1?
Yeah. Should I be eating a ton and then on a GLP-1?
Exactly. And so one of the things that I like to stress, that would be nuts. One of the things that I like to stress is that all of these studies are currently looking back. So they looked back at the people who took a GLP-1 and said, what was their risk of cancer recurrence? And remember, the people that in these studies that are taking GLP-1s are people who met the eligibility criteria to take a GLP-1.
So maybe they were,
they based on either weight or obesity related conditions.
Interesting. So, okay. So then it's definitely going to show a decrease.
Exactly. So is it going to be because, they went on a GLP-1 because they had diabetes or because they had sleep apnea, whatever their reason is.
Yeah, but those are all things that you're fixing because that
yes.
It would be something that would increase your cancer risk.
So if right now we don't have any data to say that people should be going on a GLP-1 if they don't meet the criteria to go on a GLP-1 in terms of cancer benefit.
Okay.
That might change. There are a couple of really exciting trials that are looking at prospectively, meaning putting people on a GLP-1. Again, they have to meet certain requirements and seeing what happens with cancer risk. So I think that data will evolve.
That would be so cool.
It would be cool. But I think we have to remember that they're not for everyone.
Yeah.
And we're not at a point where people should be taking a GLP-1 strictly for reduction of cancer risk or reduction of cancer recurrence. We are not there.
Absolutely not. Okay. Bone health. If you haven't had cancer, do we need to be worried about bone health?
Maybe. Yeah. Everyone should be thinking about bone health.
Why is there, I feel like there's a huge thing about bone density right now in women.
Mm-hmm. So the guidelines, and part of the reason the guidelines say you should get a bone density way after the fact that you should really get it. They cover, I think for the general population, it's somewhere after menopause, maybe even 65, which is way too late to get a bone density, in my opinion. I think
that's crazy.
Everyone should be getting a bone density. You don't need to necessarily get one maybe when you're 30, but as you're entering menopause, I think that it's a good time to think about
what if someone wants to get one at 30?
Yeah.
Can you?
I think you would have to pay out of pocket. That the details of that I don't know, because the patients that I'm ordering them for are all people that have a very clear reason to get a bone density. But if you have been diagnosed with cancer, I 100% recommend getting a bone density.
Why does bone density matter?
For so many reasons. Knowing your bone density. So if some people are walking around with really severe osteoporosis and don't know it. And
my mom has osteoporosis.
Yeah. And you would never...
osteopenia.
Mm-hmm.
But she, again, this is it doesn't always correlate.
Yeah. You don't have symptoms.
Yeah. We were shocked because, as we know, she teaches yoga and works out literally this woman can rip push-ups.
Mm-hmm. So you would think her bone density is great, but some of it is genetic. And so we don't know it. And it doesn't cause any symptoms. But if you have osteoporosis, you're at higher risk for fracture.
Right.
And the work, you want to put in the work early. So if you are 70 and you just found out that you have bad osteoporosis, think about the last several decades of your life. You could have been working to strengthen your bone density. For some people, we use medications to strengthen bone density, but even about guidance about how much calcium and vitamin D you should be taking in, what are you doing for weightlifting, right? Knowing your bone density is really important because we can then optimize the plan. And when you strengthen your bones, you strengthen your muscles, and it's this positive cycle. So if muscle mass declines as we get older. And if we're not lifting and strength training, when you lift and strength train, you create little tears in your muscle, and then your muscle repairs itself and gets stronger. And that puts more force on the bone. And so the bone strengthens, and then that puts more force on muscle. Whereas if we're not doing that, you can see how it's a negative cycle. And so I think knowing your bone density is only one part of it, but it's a key part that can help you figure out, what should I be doing?
So a girl who's my age, 24, is not going to get a baseline bone density. Should she be taking calcium and vitamin D?
So I'm going to stay away from answering that for the general population, because that's going to look different for each person. So we should talk to your doctor about what you should be doing. But I think for anyone who has a health condition where their bone health may be impacted, we should be thinking about getting a bone density.
Okay, noted. And then clean beauty.
Yes.
Products.
All the rage.
And we know there's some fallacy to calling clean beauty because that's just, I don't know, a lot of gray area. But I think about this all the time because my job is to know products, to use products, to try products. We're hearing so much about fragrance now. What's the deal here?
So here's what I don't recommend that patients do is don't go and throw out your entire makeup cabinet and start over. That's very expensive and probably not needed.
Okay.
That's
a relief.
We don't need to do that. Some people really prefer to say, you know what, I think the bottom line is this: we don't 100% know. So some people feel more comfortable saying, I know I don't know, but this is something I can control, and I'd like to use cleaner products when I can. Other people say, I'll use it if it's there, but I'm going to stick with my mascara. Right? Whatever works for you. There are some really amazing clean beauty products out there. They're fantastic.
It's like you don't even have to sacrifice anything anymore.
Exactly.
And some of the price points for clean beauty are lower because there's not as many ingredients.
Yep. And so I think we just don't know yet. I think it's a very personal choice. There are ways that we can think about kind of clean things in our life, right? So that goes, I get asked a lot about like microwaves and plastic in general. So what are, things that we can do?
Or like cleaning products.
Exactly. So I do try, for me, I try to pick cleaner things when I can, but I'm not like clean or nothing kind of way. What I don't, I did get rid of all of our plastic containers to glass. They were kind of getting old, and I was like, you know what? This is something that we can make the switch
Even
to.
like the really thick, hefty plastic Tupperware?
Yeah, I went all glass. I mean, the lid is still plastic, but I went to glass. That was something that was like, mine were so old, so I was like, all right, we're gonna swap it out.
Oh my gosh, I love my plastic Tupperware.
I know. So again, that may not be a choice that you make,
but obviously I will. Not now, but when I go to maybe move an apartment and leave it with my roommate. But then I'm like, am I poisoning her?
No. And does it make a difference? I don't think we know. We don't know, right? So these are things that like I do them because I don't know, and I'm not sure it really makes a difference.
Don't get crazy, I think is the message. Crazy.
I don't microwave. If I get takeout, I won't microwave in the takeout. I use the microwave, but I won't microwave in the takeout container.
But it's like the food's already hot that's being put in the plastic container.
But if you put it in the fridge overnight because you didn't finish it.
Right, totally. Okay, so we're like heating it up on a plate. Reoccurrence. Someone asks, what actually causes it, and what can someone do realistically to reduce reoccurrence? I'll just answer that quickly. All the things we just talked about, right? About exercise, alcohol, diet, weight, metabolic health.
And I want to say that you can do all the right things. And unfortunately, and this is not to cause fear, but unfortunately, recurrence can still happen. And I say that only because I don't want people to feel guilty if they go out and have a burger and a glass of wine. I don't want them to feel guilty that they're not doing everything that they can, right? So these are all things that can help our health in the short and long term, but sometimes bad things happen no matter what we do.
Yeah.
But why does recurrence happen? I think we're really still learning a lot about that. We do know that some cancer cells can become dormant and they kind of hibernate, and something can trigger them to wake up. And we're still learning about what that is. There have been some studies showing maybe inflammation and viral things can do it, but again, this is very preliminary and very early. I think focusing on what you can do is important, and trying to, do what you can to feel good in your body. And I know that's hard sometimes.
Yeah. Obviously, after you've had cancer, there's a lot that still goes on. And I know this is a piece that you really focus on in your advocacy, in your practice. What are you hearing from women who are coming in once they've completed treatment?
Well, and I think the key part is that it doesn't end. So the world thinks you're done, right? Maybe you've gone back to work. Maybe you're done with chemo. You rang the bell, or maybe you're taking a treatment break if you're living with metastatic cancer, or whatever that looks like for you. And so everyone's like, you're done. And they expect you to be back to normal. And you're like, what just happened? Right? And that's the part where you just start to process. Because remember, when you're diagnosed, it's go, go, go. It's appointment, never stops.
You can't even, you barely have time to sit with it. And maybe there are moments, but I think you're describing that perfectly without having even experienced it, which is such a testament to how you listen to your patients. But you finally get the time to sit down and go, what the fuck just happened?
Yeah. And that takes time. It takes a lot of work. And it's hard. And I see it in different ways. I see some people who really feel it from the beginning, and other people that are just, they kind of bottle it up because that's their coping mechanism. They're stoic and they're like, I got this, I got this, I got this. And maybe it's 2 to 3 years later that something triggers them. I have one story, someone saw a greeting card in a grocery store. It was like a cancer recovery card, and that was it. And so everyone is different, but the only way to go through something is to go through it.
Yeah.
And everyone has to feel it at some point. There's grief, there's trauma, right? All sorts of emotions. There's guilt in some patients. And so I think recognizing that that's a hard time. And I think where people really struggle is for me as an oncologist, when I was going through training, that's not the stuff you're really taught. Survivorship, and I think this is changing, but we're not really taught that part. We're taught about the drugs, and we're taught about how the treatments work, and what you do and how you manage the nausea, all those side effects, right? We're not as much.
I mean, there's a huge mental health component to this too. I suffered greatly mentally when I was going through treatment and then afterwards, and I never thought I would have a mental health concern in my life. I was like, I'm so happy. What's going on? And then, now we've been on Lexapro, then Effexor, and talked through all of that stuff. But that's not something that you think about first thing that even an oncologist would offer.
And it's also hard to kind of recognize that that's what's happening, especially if you maybe not had mental health struggles earlier, right? And you're like, what is this? I don't feel myself, and I don't feel like myself. And you remember, you're now discovering a whole new body, and people tell you, well, just tell me if something feels abnormal. And you're like, well, how do I know? Because everything feels abnormal right now. And so I think this is a really hard time. And I struggle with this also in how to talk to patients about this, because you don't want to create overwhelm. You want to prepare people. But also when you're meeting them for the first time and you're like, you're going to need this much of chemo and then surgery and radiation, it's also hard to say, well, when you're done, it's all going to be really hard too. So it's multiple conversations. And I think, but I really think that so many people, that the survivorship part is harder than active treatment in different ways.
It's a lot of isolation and grief and dealing with that, and then feeling like, why am I not feeling great? I thought this was supposed to be all over. But I think what was helpful for me was, when going through treatment, just having little seeds planted of we're going to, keep working on this after. Or knowing that there was work on the other side of it, without being told in my treatment plan, and then there was survivorship.
Good luck.
Which is hard. So I want to talk about the sexual wellness component, which feels like it's huge.
It's huge.
And it's getting more attention, still not enough. And there's a lot of misconceptions and people are confused.
Yeah. And I think that, I think part of all of this too is, how much time do you have with your doctor? Which isn't, it's not a lot. I mean, it's 15, 20 minutes at best. And that's a whole other conversation. But so sometimes some of these things don't always get discussed because there's time.
Yeah, and that's like normally the last thing you save to talk about.
And sometimes people are not comfortable talking about it.
Yeah, how do you even bring that up? And like, what is your perspective in the room with someone?
Yeah, I mean, I try to ask about it, but sometimes people are there with a partner, with a parent, with a child, and they're not comfortable. And sometimes the healthcare team is not comfortable, right? I mean, it's a very personal conversation. There's been a lot of research on this, like why are people not having sexual health conversations? And a lot of this is all of that. But we know that sexual health is, and I really like this term sexual wellness instead, is affected in pretty much everyone who's been affected by cancer to some degree.
Wow.
Right? We did a study, we surveyed over 1,000 patients, and I mean, nearly like 90-something% said their sexual health was affected.
Oh,
crazy.
So terrible and so validating.
Mm-hmm. But I think, and that's the key, I think that knowing that what you're feeling is common.
Yeah.
I think that validation is important to know that you're not alone, right?
Yeah.
That you can bring it up, that you should feel comfortable bringing it up. But it can be affected in so many different ways. You know, we used to just think of vaginal dryness, and we know that it's way more than that.
Right.
The genitourinary syndrome of menopause is not just vaginal issues. It can be urinary issues. It could be pain. It could be irritation, burning, you name it. But then also libido, orgasm, body image, just how sexuality, how you feel in your body. And then so often what your relationship is with sexuality with yourself, but also with your partner who may not know how to touch you or may be nervous about touching you or maybe, you know, there's so much that goes into it. And then you add in.
Or thinks you're normal.
Yeah. Or thinks you're normal, right?
Everything's good. They're ready to go.
Good. Or there's cultural and, you know, religious factor. I mean, there's so many things to consider.
It is really difficult. And we have talked about this in part of my personal journey, but like it was really difficult for me to realize something was going on because I didn't have a partner at the time. That was a lot. And then when I was like starting to have different relationships, really awkward to navigate, tough to navigate. And then like I just was super, super convinced I was never going to have pleasurable sex ever again in my life. Like I was like, great.
And I'm happy that you spoke up.
Yeah. So awkward.
And many people don't speak up and they think this is just what it's going to be from now on. And that is really unfortunate.
You also like hear about this all the time. You talk about this all the time. So like when I brought it up, you're like, oh, yep. Like here's what we could do. I could either read this. Yeah. I think this is the plan. I was like, oh, I remember like probably tearing up either during our appointment or after. And seriously, there were so many breakthroughs where I had convinced myself that my life was going to be one way, and then we would have a conversation and I would realize there was like other possibilities of what we could do.
There's always something that we can do, right? And maybe that in the world of sexual wellness, that may start with vaginal estrogen, but that may not be enough, right? There are other things. And I think the key is that it's not going to be, it's a conversation and it's going to take steps to fix it.
Do we have stuff for libido?
We do. We do. And I think so there are medications that are approved for hypoactive sexual desire disorder, which is a fancy way of saying you don't have an interest in sex and you're bothered by it. And we've ruled out other things that could be causing it.
Okay.
I will say there's a lot of conversation and some promising kind of conversation about maybe using testosterone in patients with breast cancer.
Interesting.
It's evolving. We need some more research, but there's some early stuff that's coming.
Okay.
So I think that, I think the conversation we have today may look different in a few years, but there are things that we can do.
It's just still so mind-boggling how many medications are on the market for men in terms of libido.
Oh, yeah.
And like none for women.
So flibanserin or Addyi is the medication that's approved for hypoactive sexual desire disorder. There's another one, Vyleesi as well.
And that's like a pretty like that's like a condition
that you can be prescribed this medication.
It's not just like, oh, like maybe I want to get my libido up.
Yeah, it's an actual, there is a diagnosis for it. So Addie just came out. They have a documentary film called Little Pink Pill about the approval to get the drug to market. And what's crazy is that this drug was denied multiple times by regulatory agencies. And one of the reasons why it was denied was they thought it would make women too sleepy, so they couldn't get their kids to work in the morning. Get their kids to school in the morning.
People like hate to see a woman thriving.
Yeah. Like
it literally boggles my mind.
Like, would that ever occur about like men might get too sleepy,
so they can't get their kids out the door in the morning?
Crazy.
Shut up.
If you have an hour, watch Little Pink Pill. I'm not involved in the film, but I've seen it and it is fantastic.
Big fat eye roll to that.
Yep.
It's just beyond me.
Crazy.
Anything else about menopause?
I think that menopause there's a big conversation happening around menopause. And I think the challenge for anyone who has had a hormonally sensitive cancer is that hormone conversation kind of feels out of reach for the patients who've been diagnosed with hormone
all my
positive
friends are talking about
cancer.
Periods, birth control, or like it integrates into everything when they're talking about like different acne medications or all this stuff. I'm like, it just does not apply.
And I think that's really hard, and people feel really left out of the conversation because we're talking about menopause and we're talking about hormones, and here are 70 to 80% of women with breast cancer are saying this doesn't apply to me. And actually, I'm going to plug my book here for a second.
Please.
But that was one of the reasons that I really wanted to write my book. And hormones have like literally 3 pages in the book. And the rest is all about all the other things. Like, how do we take care of our bones and our heart and our brain without hormones? Because there are so many great resources available for people who are pursuing that path. But for everyone else, I want to make sure that we have that conversation, because there's so much you can do to sustain. And hormone therapy is one part of it. And it's a great option for people who choose to go down that road. But there's the foundational piece of how are we taking care of our bodies every single day is also really important.
Absolutely. When we're talking about the brain, brain fog, cognitive issues is so hard and fatigue I want to talk about.
Yeah.
These are things that I just gaslight myself about 24/7. And like, I feel like I've completely written them off or been like, oh, I'm just so forgetful. And it's like, why am I playing this weird ditzy card when I know there's something else going on? And like, I let other people think that about me too, even though
it's a coping mechanism.
Oh, it's so annoying. I can never figure out like if it's me or if it's this symptom. But I do think I have brain fog.
And you might. I mean, I think the piece is that the treatments that we give for cancer and premature menopause can contribute to brain fog. There's a term for it. It's called cancer-related cognitive impairment. And what's crazy, and we know it's real, and there are people who don't believe that it exists. Isn't that crazy?
Women haters.
Yeah. But there are medicines, endocrine therapy, so your aromatase inhibitors, chemotherapy, all of those things can contribute to cognitive impairment.
Okay, so what do I do?
Well, there's a lot that we can do, and it starts with coming back to that lifestyle.
Okay.
Right? And the biggest part of that is, how are we sleeping? And we think about sleep, and we think about all the ways that our sleep is impacted, right? And so it's not just how are you sleeping, because maybe you're really struggling, not you, but maybe someone's really struggling with anxiety, and that's impacting their sleep. And so now they're not sleeping. And then because they're not sleeping, they're waking up and they're achy and their joints hurt. And now they haven't exercised because everything hurts, right? And it's this vicious cycle. And so it's not a one size fits all solution, but even thinking about, I like to always think about what can we make 10% better, right? I can't fix everything overnight, but maybe we can cut down on something. So alcohol, for example, really messes with sleep. Really does. And so one of the things
people love to say that,
oh yeah, have a glass of wine, you'll sleep better. No. It is
I'm like, you guys
for sleep.
Are you even in tune with your body? Because that is not any time I drink. I'm like,
your sleep is awful.
Awful.
And so sometimes people say, I'm really struggling with sleep. I'll say, look, cut out alcohol completely for a month and see what happens. Or if you're like, I want to cut down alcohol, but I can't cut it out completely, maybe you move up the times. Maybe you're not drinking, an hour before you go to bed. Maybe you have a drink in the afternoon.
Yeah.
So really thinking about on each individual level, what are some things that I can do? If you're really struggling with anxiety at night, can we address that? I like this concept of doing a brain dump right before bed, like get it out of your head and on paper. Again, is it going to fix everything? No, but maybe it'll help you feel maybe a 10% improvement in your sleep, and then that will help you feel a little bit better in the morning. But I think everything's connected. In menopause, people have higher incidence of sleep apnea. And so they are like, I'm getting 7-8 hours of sleep, but I'm waking up exhausted because they're not getting restful sleep.
Right.
So there's so much to it.
I think phones is also a big one.
Yeah, so I got the brick after you.
What do you think?
I love it.
Really?
I'm obsessed with it.
Okay, influencer. I did that.
Obsessed. She did that, and but it's huge. And then so it was funny. So I use it. I put my phone on. Brick it at night, and I was like, oh, my sleep is better. And so I really did this deep dive, and actually, there's data on how social media at night bad for our sleep.
It's so bad, and there's no worse feeling than waking up and scrolling.
Yeah.
It really messes with my brain, especially because that's a little bit of my work. So I go in the morning, comparison, you're not good enough.
Exactly. And
Horrible way to start the morning.
Well, you've started the day bringing in all these opinions into your day.
Yeah.
Whereas
bringing everyone into my bedroom.
Exactly.
That's my space.
Yeah. Rather than saying this is, especially if this is what you do for work.
Oh.
Right? Because you can't disconnect.
Yeah, absolutely not.
But scrolling and give yourself, you really like, don't scroll right before bedtime, or don't bring your phone back to you, or turn off social media. And someone said to me, the brick is a device that turns off your apps. Turns off your social media apps. Someone said, why do you need that? Why don't you just not go on social media? And I was like, because we are all addicted.
It's so crazy to me that people think that they are smarter than the absolute masterminds who spend all day and make millions and billions of dollars to figure out how to hack our brains so that we become addicted to their technology and software. Like, I'm not smarter than Steve Jobs. I'll say that. Yeah. I don't think anyone else really is smarter than a team working at Instagram, X, Twitter,
whatever it is,
to get you addicted to it. Like, so
like if
we're
I
not
see
really
my
in control.
phone is next to me, I will like subconsciously pick it up and be like, oh, what,
Also, to every single person listening, like you have 100% gone on your phone, started scrolling, and then looked up and gone, how did I get here?
Yeah.
What am I even looking for? What am I doing here? Or how about this? What did I just look at?
Yeah.
Can't even remember.
And now you've gone down and you've spent, half an hour where you could have been maybe reading a book or sleeping or,
lifting those damn weights.
Exactly. Whatever it is. And so I think there is certainly, I think social media is great in many cases, but I think we have to be mindful of what we're consuming online.
Yeah.
And remember also, understanding when we're consuming it. And if you are searching for cancer information and education, nighttime may not be the best time
to
do it, because that's when our minds are all over the place.
I heard a great rule that was like, after 10 p.m., like nothing counts.
Yeah.
Like, don't be having serious conversations. Don't be making decisions. Like, you should not be operating your life after 10 p.m. That really made something click in my brain, because I was like, the times where Quinn and I will get home from a bar and try and have, no. You've already lost. You have already, both of you have already lost.
Exactly.
I also have to plug the brick because not spons. I will brick my phone at 7 p.m. It automatically turns on. Then I go through my night. It's so nice. And oftentimes then I get to wake up and make my breakfast, like kind of get my life together. I'll still check my email, but then only when I really either have completed some tasks or I'm ready to go out for the day will I unbrick my phone. Yeah. And it's like, has created so much peace in my life.
And productivity. And you just feel, I think that there is this push for a lot of people, right, to get back to human connection and to get back to in-person connection. And I think social media absolutely has its roles, and I think really helps people become...
listen, that's our bread and butter.
Yeah, that's how all these things have happened for me in terms of like really growing my career. But I also think there's a time and a place for it.
Absolutely. Okay, I now want to talk about the future.
Love the future.
Where medicine is going. So Dr. T and I have a fun game where every time I come in for my appointments, I'm like, what's new? What are the new studies? What could you tell me? Because obviously in my brain, I'm hoping one day I come in and she's like, we did it. We cured it. So actually not the case yet.
Not yet.
But there's a lot of good studies and a lot of nice data coming out that you know all about.
So my dream in life is that we cure cancer and I can retire and open up a coffee shop and a bookstore. That is like my
Do you think
dream.
It could happen?
I hope so, because one of my patients brought me this beautiful hand Etsy designed poster that says Dr. T's Bookshop. I love it so much.
That's so sweet.
Because I had told her this story. And so that is my goal, because I have to have somewhere to display this.
Yeah.
But I will say how we treat cancer, I mean, in the last 10 years, it has been revolutionary. And I think the progress is really ramping. So I do think we're getting better. We have a long way to go.
Yeah. And is there really such a thing as a cure for cancer, or is it more just...
So, I mean, I think we have to think about this. Each cancer is so different. Even within breast cancer, I was listening to your episode with Katie where you guys were talking about all the, how many different breast cancer types there are. Yeah. And so we can't say kind of general cure, because cancer cells are smart and they're all different. So I do think that we try to treat with curative intent for certain stages, but that does not mean, and then what we try to do is focus on reducing the risk of cancer recurrence. And ideally, of course, we want to get that down to zero. We want to get people who've been diagnosed with stage 4 breast cancer to a state of no evidence of disease. And so we're working toward that, and things are moving. Sometimes progress feels slow. So for example, it takes about a year from when the study is presented to get that drug approved.
Right.
And it can take 10 years to bring a drug from development to FDA approval. But we're seeing things move quickly. So I think what are some of the exciting advances that are happening? There's a lot of talk about SERDs, which are selective estrogen receptor degraders, which they don't block estrogen production, but they degrade the receptor. And these seem to be, there's a lot of excitement about them. They may be better drugs. They may have less side effects. So they're approved for stage 4 cancer, not for early stage breast cancer yet, but we're hopeful in the end of the year, early next year.
Wow.
Stay tuned. I don't have any insider knowledge of this, but
early next year, we think they'll be approved for stage 3 and below.
Stage 3 and below, at least based on what is publicly available.
Could I do it?
Probably it will depend on what the approval comes out. So we don't know, right? The study's done and then it goes to the FDA and the FDA decides how they're going to approve the drug.
But how cool could that be? That I could be on something new that I haven't heard of.
Yep. And I think that's huge because we haven't had a major advancement like this in this space for decades.
Oh.
So I think that's
so
great.
This is like crazy.
This is crazy. A lot of excitement, a lot of buzz about the drugs. And the study that was presented is just one of the SERDs. There are many others in early stage cancer that are coming and being studied. So I think that's going to be kind of a paradigm
And this is
change.
something that's super effective in metastatic disease?
In metastatic, for the specific population, it's nuanced in metastatic. There's a lot of research happening in that space as well that probably will change. I think the other thing that everyone's talking about is circulating tumor DNA, and this is like the Signatera test. Should we talk about that?
Yeah. I mean, I just asked you about it. Or no, I didn't. No, I didn't. But I've been wanting to because some people are like we've talked. Okay.
Well, let's go through it.
Okay. You just talk about it.
So circulating tumor DNA is if you have cancer cells in the bloodstream, as they die, they will shed DNA and we can measure that. So there's different tests out there. Signatera is one. And what Signatera does is it creates essentially it takes your original tumor, runs it for different mutations, and then makes an assay that you can then check for in the blood. So it kind of matches the cells. There's a lot of interest, a lot of research ongoing into it, and there's a lot of push about should we be checking for circulating tumor DNA in everyone, in the right patient. And there's a lot of nuance to it and limitations to it. So let's say someone gets it's a blood test. We don't know how often to do it, but typically people are doing it every 3 to 6 months if they are. So let's say you get a Signatera test and it's negative. That's Great. That means, at least right now, we can't identify any circulating tumor DNA. The test, there are false negatives, there are false positives, so it's not perfect. Let's say we get a test and it's positive, and then we then send someone for a scan. And that scan shows that there is a cancer. Then we treat that. The part that we don't know necessarily how to act is you get a positive Signatera test and a negative scan.
Ugh,
So that's this
eerie.
like, what do you do? And there's a lot of research going on right now is, can I put you on X medication or can I put you on Y medication to try to get that positive to become negative? But as of today in 2026, I don't have that information. So I can say it is likely that within the next few years, your cancer will recur. But I don't have an intervention. I don't have a medicine to give you today. So that's the nuance.
That's going to send me spiraling.
Exactly.
Oh
So
my
for
gosh,
some people,
it's like, do you want to know your fate?
Yeah.
Like, I'd rather just be like hit by a bus.
And so some people say, I really need to know. I want to know. And other people say, I don't want to know because I don't want to have that possibility of like,
Okay.
So it's nuanced for everyone. There are some people who do it and they find a lot of relief in knowing, and other people don't do it. So it's a personal choice. I think for now, I think as the science and the research progresses and we maybe have interventions about what we can do,
Then it would be
then
like,
that will
let's do it.
change, because right now we don't know. And we also don't know is finding it on a Signatera test, will that help people live longer in the long run? I don't know the answer to that.
Okay.
So my take on it is I don't deny it to patients who want it.
Am I crazy, or does it feel like kind of like a mental health thing?
There's going to be situations where we might do it. Maybe someone has a very high risk of recurrence and we really want to pick something up early.
Okay.
For some people, they'll say, you know what, I know I'm at risk for recurrence, but I don't want to know because I don't think I could live in that in between. Other people say, if it's positive, then I'm going to do this. I think you have to really consider it on a case-by-case basis, but we're certainly not at a point where everyone should be getting
So
that
I'm
test
not
done.
Testing.
Yeah, I think you have to think about whether that's going to be right for you or not. I will say most people still, there's a lot of talk about it online.
Yeah.
And I think people are starting to do it a little bit more, but the majority of patients still are not having it done.
I don't think I'm going to do it, but that's also because I'm not getting cancer again. So
There you go.
I have 2 intrusive questions that are out of line, and they're personal. Do I get scanned at 5 years?
So great question. It's really, like everything we talked about, a personal choice. We can talk about it. The hormone receptor positive cancers can come back 5, 10, 15, 20 years down the road, which it is what it is. And some people really find it helpful to get that 5-year scan. I don't know, it gives them like this.
Isn't like 5 years, I feel like there's buzz around that, because isn't it like less, like
that's
like,
going to
why
be
is that a
more
big
for
milestone?
triple negative, where there's really, if it's going to come back for triple negative, it's going to be within the first 5 years.
Really?
So for
Okay.
5 years at triple negative, that's a huge milestone.
Got it.
And a lot of people do like to get a scan at that point, just because, again, it gives them
Peace of
mind. But I always say a scan can only tell you what's there today, so it's not telling you about anything that could show up in the future. So it's a personal choice. I do have some people who say, you know what, I this will help me, and we do it. But you also have, for everyone, we always have to think, okay, what's the downside of doing a scan? And it is radiation exposure. I mean, one scan is fine, but we want to think about that in the context of other things. So it's something that you should discuss, people should discuss with their doctor. But the guidelines, if we're going by guidelines, don't say you don't need a scan unless you have any symptoms.
Okay, I would like to get one.
Okay.
So that'll be next year. Okay. And what does colostrum do?
Colostrum. Lots of buzz about that as a supplement. I think the bottom line is some people like it. They say it helps them, but you don't really need to take it.
Like for what?
I think the latest is like skin, nails. To be honest, I don't even remember now, but I don't think that you need to. Okay. Immune system, I think, is another thing that people take it for. But I did a post on this like a while back. I have to look back at that.
Yeah. Okay. BC vaccines.
Lots of buzz about breast cancer vaccines. I am really excited about this. I think we're making progress. Cancer Vaccine Coalition is an organization that is like doing amazing
Dahlgren
work. Love them.
Yeah.
They're doing such amazing work in bringing these vaccines, getting funding and all of that. I think we will see them sooner rather than later.
Cool.
Not in the next like year or two, but we're making great progress. And the goal is, the idea with a breast cancer vaccine is to expose your body to a little piece of, like, for example, a HER2 vaccine it's being studied right now, exposes your body to a little piece of the HER2 protein, not enough to cause any cancer or anything, but it teaches your body that is foreign. So if there's a recurrent cell that then has that, your body go, this is bad, and get rid of it.
Yeah.
So it's training your body.
Is it just for HER2 right now?
No, there's all different vaccines in development.
Wow.
Lots happening. If you are listening and you want to learn more, Cancer Vaccine Coalition and then also clinicaltrials.gov will tell you about all the vaccine trials that are available. So lots happening. I think we're making progress. This is a great organization to donate to because they put their money, they put that money right into research.
That's amazing.
As well as some of your wonderful sponsors on this podcast.
Yes. What gives you hope when you think about metastatic breast cancer?
I think we're really making progress, which is amazing. People are living longer. Unfortunately, people are still dying from metastatic breast cancer. And so I think we have a long way to go.
Yeah.
But there's such amazing research. We have new drugs. We have antibody drug conjugates. We have immunotherapy. We're really making a lot of progress. And I think we're also focusing on quality of life and living with MBC in a way that we haven't before.
Yeah.
And talking about symptom management and thriving.
That's so important.
People are going through fertility and surrogacy and like all these amazing things. So I'm really inspired by that. And I think, again, when I did my training in the early 2010s, we didn't have any of the drugs that we have now. So it's like insane. It's completely different, and I think it will continue to evolve.
I think it's just going to keep picking up speed, especially with AI and all these new tools we have.
And can we use AI for good?
Oh, yeah.
And I think here is where there is a lot of opportunity.
Absolutely. Okay, when we're talking about appointments and you as an oncologist, people are coming into you in their most fragile state.
Yeah.
I saw you mostly after my treatment, but you as a patient, like from my perspective, like oncologist is God almost. So when you're talking to patients, like, and obviously you're an extremely empathetic person, is that emotional? Are you able to compartmentalize? Like, where's your head at as a doctor?
Yeah, I mean, I think this is hard. And I think what sometimes people don't always realize about being an oncologist is that you'll go from one room where it's appointment after appointment, right? I see 20 people a day. And so you'll go from one room where you're talking about hospice or end of life or maybe a bad scan that shows a recurrence to then celebrating someone who's 5 years out, right? And then you'll go to the other room and we're talking about menopause. And then we'll go to another room, we're talking about chemo side effects. So it's this like every day is so
it's like whiplash.
Different. It is whiplash. And I think one of the challenges is that you don't always have time to process those really difficult conversations because like you have to just go. And so I do think there's a little bit of compartmentalizing that has to happen so that you can focus on who you're with now and what do we do for that person and how do we help. And I think this is why you shouldn't treat your friends and family because it is hard to do that. But I take it home with me. I think about there's some days that are really hard that I'll just drive home in silence because I'm like, oh my God, there's so, and you're really thinking about the patients. I think that's important. I think the day that you don't is the day you shouldn't do this anymore, right? I think.
Wow.
So I do think about it. I live about 25 minutes away from work, and I kind of like that because it gives me time to decompress a little bit, especially after some hard days. That you can then go home and all right, now you got to do all the home stuff.
Literally superwoman.
Yeah, not at all. I have a lot of help. But I think it's hard. And I think recognizing also that doctors are human, and sometimes And I say this sometimes and I won't speak for everyone, but I'll say sometimes like maybe something hard has just happened, right? And then someone may not have, like, you may not show up in the way that you wanted to for your next patient, because we are all human. So I say that in a way of, if someone has ever had maybe a day, an appointment that didn't go as well, like, maybe reach out, maybe give it another chance. And again, everyone is different.
Totally.
Thoughts on that. But sometimes there is a reason or why doctors are late all the time, because we're dealing with something really hard.
Yeah, you're like, they're late all the time. And it's like, okay.
Yeah. And I am late very often. And it's not because I'm sitting in my office, it's because
lifting weights.
Yeah. I mean, that would be nice, but I'm not, it's because either we're having a really hard conversation, or we're doing insurance authorizations, or calling someone about their scans. And so I think at the same time, we hate to make people wait, because it's your day and your time and your life. And that is just as important. So I think there's a lot of work we can do to fix some of these things. But, I think everyone's human.
You are absolutely incredible. Before we finish off today's episode, I want to do a rapid fire round. So whatever comes to your head. One thing every woman should do for her health this year.
Move. Get out and move.
Love. Most overhyped cancer wellness trend.
Detoxes. Cancer detoxes. Your body is designed to detox itself. But there's a lot out there, and people are charging thousands of dollars for these things. So it is taking your money.
Scam city.
Mm-hmm. Scam city indeed.
Most underrated habit for longevity.
Sleep.
Wow.
And movement. But I already said movement, so go with sleep.
Okay. Something you've changed your mind on recently.
So I think really in having a little bit more of an open conversation about hormones. I think that we were all taught no. And I think as we're listening to patients, and as we're really having these conversations and looking at the data, I think we're becoming a little bit more, hopefully, open-minded about some of these things.
I love that. And what gives you hope right now?
Research.
We love research.
Yes, we love research.
I cannot thank you enough for bringing your expertise to this podcast and being my wonderful oncologist.
Thank you for having me.
Yay! Thank you so much for listening to today's episode. Before this ends, remember to share this with anyone who you love in your family and give us a review. It actually matters, believe it or not. And lastly, I want to thank our sponsors, NBC Cure and Cancer Culture. NBC Cure is a nonprofit dedicated to funding research and advancing treatment options for metastatic breast cancer, so people living with metastatic disease have better outcomes and more time. And Cancer Culture is a platform that creates space for honest conversations about the cancer experience and life beyond diagnosis. Thank you, and see you next time on PINK365.